So our challenge at Carolina's healthcare system 3 years ago when we started a service line of behavioral health was to take care of the population. And we know that 1 in 4, 1 in 5 people is suffering with a behavioral health issue at any given time. So in primary care for us at Carolina's healthcare system, that's 200 primary care offices, about 800,000 people. So that's a lot of people. So we were charged with, please help us take care of that population and try to take care of them in primary care before it gets worse, where there's less stigma and patients were more likely to come and talk about things even than going to see a psychiatrist. So we looked around the country, this was 3 years ago, and said, well, there's a few models, but what's the one that fits best with us and that has a lot of data and support? So we found the IMPACT model, or the collaborative care model, out of the University of Washington. Drs. Caton and Unitzer developed that. And so we picked that model. Now that model has a role called the BHP, or the Behavioral Health Provider, that is usually co-located in a primary care office. But again, we had 200 primary care offices. We couldn't afford to hire enough people out of the gate. And that's when we started thinking about using a virtual behavioral health team to do it, not just telepsychiatry, but a whole team that's virtual. And in order to do that, we took that role of the BHP, Behavioral Health Provider, and deconstructed it. So we said, what does that person do? Well, they diagnose and they screen and they sometimes do therapy and they help people navigate and they do a lot of talking back and forth between the primary care team and the psychiatrist, so a lot of communication. And of course you need a psychiatrist. So we deconstructed that role and then just reconstructed it, reconstituted it with a virtual behavioral health team. So we have a pharmacist, we have social worker, we have therapist, we have a psychiatrist, of course, navigators, coaches, and that's our reconstructed behavioral health provider that's really now a virtual team that you can now deploy to a number of primary care offices.